Before the pandemic, the number of people diagnosed with diabetes had doubled over the previous 20 years. Now, new research finds that COVID infections are causing even more people to develop diabetes, and we don't know why. Experts say the need for early interventions to get ahead of the problem is more urgent than ever. Around 1 in 5 American adults visit an emergency room each year seeking care for an urgent health problem. These often random moments of contact with the healthcare system creates opportunities to discover other underlying undiagnosed issues.
It's required that our triage nurses ask every patient that comes to the emergency department if they like screening for HIV.
But Dr. Reed Caldwell, Chief of Emergency Services for NYU Langone, wanted to look for another insidious disease that often goes undiagnosed for far too long.
In the communities that we serve, the threat of diabetes, prediabetes, is actually more than the threat of HIV presently.
Caldwell says healthcare institutions need to shift toward identifying and treating people with diabetes earlier. In 2018, they started offering ER patients the A1C blood test at one of NYU's Brooklyn hospitals.
Patients over 35 years old, patients with a BMI over 25, and patients that don't have any history of diabetes or prediabetes. Those are the patients that flag for us to screen.
Their suspicions were confirmed.
Been seeing 40 to 50% screen positive for prediabetes or diabetes.
When you saw those figures coming in, what went through your head?
That we need to do more, and we need to keep working harder.
The program, which started at one of NYU's Brooklyn hospitals, has since expanded to its emergency departments throughout the New York City area. When a patient tests positive for prediabetes or diabetes, they're then linked to a provider who can help them manage it. But it's just the first step that isn't standard practice yet around the country. Avoiding or reversing full-blown diabetes is no small feat. It requires a complete lifestyle change.
I know you are experts in this brochure.
They need regular check-ins. They need a lot of education around the different pillars of lifestyle change. People need to understand, how do I work with my family around this? What happens if I go to a party or out to dinner?
In 2019, at Bellevue Hospital, a government-run facility in New York City, Dr. Michelle McMacken helped launch a plant-based medicine program to better support patients with diabetes, prediabetes, and other chronic conditions.
A suboptimal diet is actually the #1 risk factor for dying of a chronic disease. The evidence is so strong around eating a plant-based or mostly plant-based diet for reducing risk.
Patients in the program are offered cooking classes and work with doctors, dietitians, health coaches, and support groups to make lasting changes to their diets and daily habits.
If it's a relatively new diagnosis of type 2 diabetes and people make intensive lifestyle changes, we have great science to show that many of them can go into remission.
El programa para mí ha sido como la rueda que me hace seguir adelante este equipo de personas que está involucrado en esto.
Glenice Torres was first diagnosed with prediabetes in her native Dominican Republic. After moving to the U.S. 3 years ago, she found out she was in fact a diabetic. Before enrolling in Bellevue's program, all her previous efforts to change her habits didn't stick.
A subir de peso y a subirme la diabetes.
Then, during the pandemic, Torres's health worsened.
Subimos de peso, subieron de peso.
We all gained weight.
Oh, you did?
Yeah, we were here watching TV,
we weren't going out.
eating.
Mm-hmm.
Yeah.
I'm Cheryl Wills with the latest on the coronavirus pandemic. The United States overtakes China as the country with the highest number of coronavirus cases.
There's been a lot of very interesting data coming out about this link between a COVID-19 infection and diabetes.
It's just one of the many underlying health conditions that can lead to severe COVID-19 symptoms.
Were you worried during the pandemic when you heard of how COVID could impact people with diabetes?
Cómo murió tanta gente y que la diabetes ponía más en riesgo Eso me impactó mucho.
Torres says she also simply wanted to feel better.
Estaba viviendo una vida de una persona de 80 o 90 años. Entonces yo dije, yo soy muy joven para esto, yo tengo un nieto de 2 años y necesito energía.
7 months after she started the program, Torres has seen a real transformation.
He bajado casi 20 libras. Y lo que es más importante, mis niveles de glucosa están bajando. Y eso me da energía. Mi estado de ánimo ha cambiado.
Each day, she prepares healthy plant-based meals for herself, swapping meat with tofu, white rice with brown, and adding plenty of veggies.
La comida es mi aliada, la que me da energía, la que me da salud.
She's still able to enjoy some Dominican favorites, like rice and beans, but she's learned how to prepare them in healthier ways.
Y he agregado, por ejemplo, a mi plato más colores, amarillo, rojo, que son lo que me da entonces la vitamina y la fibra.
Torres says she sees the need for broadening education and access to healthier foods in her community.
Los de clase de minoría, los hispanos, las personas de raza negra, pensamos que comer saludable no es para nosotros porque venimos ya con esta costumbre de comer diferente, de comer comidas fritas.
Recently, during a trip to a health food store, she asked a Spanish-speaking employee for help finding ingredients.
Entonces ella dice, ay no mija, no busque eso aquí, este supermercado no es para nosotros, es para blanquitos. Entonces me sentí bien triste.
Black and brown communities experience the highest burden of diabetes, partly because there are fewer options for healthier food, and supportive lifestyle medicine programs like Bellevue's are not widely available. It's something I've had many discussions about with my colleague, Spectrum News political anchor Errol Lewis. We've seen dialysis centers pop up. It's become a part of everyday life for many people, and it feels sort of inevitable.
There's this tragic normalization of it, where you'll hear people just in conversation on the block or in church talking about, oh, my sugar's acting up, as if it was a sprained ankle or something like that, as if it was just a minor inconvenience. And I've seen it in my own family, seen it among friends. It's one of these things where you want to try and intervene in the conversation and tell people it doesn't have to be this way, and you can turn it around remarkably quickly.
Errol, what's needed from a policy perspective to make lifestyle solutions a standard part of medical care?
There's no substitute for somebody, whether it's a governor or a mayor, a political leader of some kind, stepping forward and saying, this is what we're going to do and this is why we're going to do it.
New York is going to change the conversation about using food not to feed healthcare crises, but to stop the crises.
One remarkable transformation is a very public one, the story of New York City's current mayor, Eric Adams.
Absolutely. He had a diabetes diagnosis that came about because he was experiencing severe distress. He was losing his sight in one eye. He switched to a plant-based diet and within 2 months had dropped, I think, 35 pounds. Within 6 months, had reversed the diagnosis, had basically brought his blood sugar in line. He's been an evangelist ever since for a different lifestyle.
Adams has long advocated for systemic change in healthcare. Now he's making Bellevue's plant-based medicine program available at 6 more sites, with Dr. McMacken leading the initiative.
These evidence-based lifestyle behaviors can have a huge impact, not just on preventing and reducing the risk of chronic diseases, but actually treating these conditions, and in some cases, actually turning things around, just as Mayor Adams did.
We have a mayor who was struck with diabetes, who happened to take this particular course of action, who now believes that he can sort of bring it to scale and use it as public policy. You needed all 3 of those things to happen at the same time as you have a budget that can accommodate it.
It's not how much it costs for this program, how much it's going to cost us if we don't have this program. Our healthcare system is not sustainable.
Nationwide, the CDC estimates the annual cost of diagnosed diabetes is more than $300 billion, not to mention the emotional costs of living with chronic illness and the impact on those who care for them. Adams and McMacken hope New York City's program can serve as a model for how public dollars can be better spent to fix the crisis.
We are trailblazing here. What I would like to see is really for this to be a household concept in the medical home and in people's homes.
Thanks for watching our YouTube channel. For more stories in your community, click the subscribe button here. You can also download the Spectrum News app or watch us on TV for the latest information, balanced coverage, weather updates every 10 minutes, and more. We'll see you then.